first muscle test I'm going to be performing is the gluteus medius muscle test. Grab both feet, bring out the right foot, I'm going to lower it about 1 inch and internally rotate it. And I'm going to try to push your ankle towards your other ankle, and I need you to resist. Good. That is a 5. Next muscle test that I'm going to be performing is the psoas muscle test. I'm going to grab just below the Achilles tendon. I'm going to elevate 45 degrees and bring out 45 degrees. From here, is it alright if I palpate right here? I'm going to palpate, and what I'm going to have you do is I'm going to push down and out on your foot, and I need you to resist. Okay? That is a grade 4, which needs further evaluation. The next muscle that I'm going to be testing is the quadriceps muscle test. I'm going to have you bring your knees up and keep your feet on the table. What I'm going to do is I'm going to lift up this leg, and I'm going to put my hand on the quadriceps muscle, not on the patella, and I'm going to push down on your foot, and I want you to resist it. Okay? Here we go. That is a grade 5. Now I'm going to be testing the navicular. My segmental contact point will be the lateral aspect of the foot. My contact point will be at the height of the medial longitudinal ligament. From here I'm going to turn to a 45-degree angle. And my line of drive, having my arm parallel to the table, will be superior to lateral, and it will just be a quick thrust, superior lateral. Now I'm going to be adjusting the cuboid. Contact point will be right at the bend, right, that's where the cuboid lives. I'm going to wrap my fingers around the lateral and the medial malleolus. I'm going to elevate the patient's foot off of the table and come to the side of the table. From there, I'm going to wrap my indifferent hand around the rest of it, having my thumb in the palm of my indifferent hand. From here, I'm going to drop the patient's foot with the backs of my hand in between my knees. I'm going to give a thrust. Now I'm going to be adjusting the cuneiforms with my headward hand. I'm going to go down the shin until I find the lateral medial malleolus. From there I'm going to wrap my index finger around the medial arch. I will elevate the foot with my footward hand. I will contact the sole of the foot with my pinky next to my index finger. I will cause traction with my headward hand, and with my footward hand I will give an impulse inferior to superior. Now I'm going to be checking the left metatarsal heads. From here, I will wrap my hands around her foot, the dorsal aspect of her foot, and I will be pulling S to I with my hands, and with my thumbs I will be pushing I to S, checking for any articulations on the metatarsal heads. And from there, I will find any articulations and I will give a thrust from I to S. Now I'm going to be adjusting the talus. With my inside hand, I'm going to bring it down, my pinky just past the medial and lateral malleolus. From here, my thumb will wrap around the sole of the foot. I'll elevate the foot. From here, with my outside hand, I will also wrap that around my inside hand. From here, I'm going to bring my elbows in. I'm going to dorsiflex the foot and slightly evert the foot. And from here, I will give a little bit of traction, and then I will give a thrust. Now I will be adjusting the calcaneus. With my outside hand, I'm going to wrap around the heel, the calcaneus bone. With my inside hand, I'm going to grab the medial aspect of the palm of the foot, and From there, I'm going to make rotations, stabilizing the calcaneus, which will disturb the articulations in the foot. I'm going to be making 8s in circles to be able to fix any of those articulations that may be stuck. Now I will adjust the fibular head. I will have my patient bring their knee up. I will locate the fibular head. From here, I will take a tissue pull going inferior to superior, and once it has passed, I will go lateral to medial so that my knuckle, my first knuckle, is directly behind the fibular head. From there, I will elevate the foot 1 inch off the table. I will push the leg back, and I will thrust to adjust the fibular head.